Morning and welcome. Thank you so much for joining us today. I'm Lindsay Goldman, CEO of Grantmakers in Aging. We are a membership organization that serves as a network and resource for funders and a champion for aging-related issues and investments. With over 100 members, GIA works to mobilize the social, intellectual, and financial capital required to improve the experience of aging now and in the future. GIA and our members have a history of being responsive to emergencies and disasters, which brings us here today to learn about what's happening on the ground in Ukraine. Many of us have been deeply disturbed by what we've seen and read and want to better understand how we can support older people and their families who are sheltering in place, as well as those who are evacuating to other countries. We have two goals for today's session. The first is to elucidate and elevate the needs and experiences of older people who are still in Ukraine and those who have evacuated. And the second is to provide specific strategies for those who want to contribute to the response effort with assurance that the funding will be used by organizations that are best positioned to assist older people in need. To help us understand this rapidly evolving tragic situation, we're joined by our colleagues from HelpAge USA and HelpAge International. HelpAge operates the only global disaster response network for older people in low and middle income countries, and they've been on the ground in Ukraine since 2014. I'd like to welcome our speakers. Cindy Cox-Roman is CEO of HelpAge USA. She previously served as board chair, as well as board chair of HelpAge International in London. Cindy has spent her career in the fields of strategic research, communications, and global aging. Akbar Nazriev is country director for HelpAge International's Ukraine program based in Kyiv. Akbar has 12 years of experience working at HelpAge in different operations and program roles and countries. He is currently based in Chisinau, Moldova, working on humanitarian response in Ukraine. And Cherian Matthews is Director of Global Impact and Resourcing at HelpAge International. So first, we'll hear from Cindy, and then we'll have an opportunity to take your questions. We will be recording this session for those who could not attend today. We will also share the slides. Please keep yourself on mute. If you have questions, please type them into the chat, and we'll go through them during the Q&A portion of the program. Thanks.
Thank you, Lindsay. And thank you, Emily, for your assistance with the slides, and appreciate the opportunity to share with everyone about older people in crisis in Ukraine and HelpAge's response. Next slide, please. A little bit about our organizations. HelpAge USA is based in DC and advances the well-being and inclusion of older people around the world. We work in the US and with our HelpAge Global Network partners in over 80 countries to ensure the contributions of all older people are recognized and they have the right to a healthy, safe, and secure life. HelpAge International is the UK-based secretariat to the HelpAge Global Network of organizations. HelpAge works to improve the well-being, enhance the dignity, and amplify the voice of older people. HelpAge International is the 2012 recipient of the Conrad and Hilton Humanitarian Award. Next slide, please. So I know that everyone is familiar from watching CNN, from watching the news, reading the news about what is happening on a high level with older people, and on a micro level, what's happening with older people in Ukraine. 1 out of 4 people in Ukraine are 60 years of age, and they've been disproportionately impacted by the crisis in Ukraine. Based on UN estimates, 32% of those who are in humanitarian need are older adults, as well as 13% of those in humanitarian needs have disabilities. As you all know, older people have health and mobility issues, which often act as a constraint in movement, which is a very disastrous situation in a crisis like this. We're also operating in an environment, or they are, in which there are disrupted supplies. Active shelling and airstrikes are impacting water supply. There are damaged electricity lines and gas networks, which means that older people don't have heat. And it's freezing. Temperatures are regularly below zero. Local supply chain disruption is hindering access to basic needs. And road conditions and curfews are affecting access to food and medications. Next slide, please. HelpAge conducted a telephone survey of over 1,500 older Ukrainians in Donetsk and Luhansk on March 1st and 2nd. So very recently, of course, Things are changing rapidly, but we do have this evidence. Just so you know, I'll get into this, but HelpAge has been working in Ukraine since 2014. This is not new work for us. We have been working close to 5,000 older people who are near the conflict zone and are often alone and isolated. Doing this telephone survey, the numbers are not surprising, but still startling. Almost universally, older people do not want to be evacuated from their homes. You all know, working in the aging field, older people typically do not want to leave their homes. And even in this crisis, they don't want to be evacuated. 9 out of 10 report that they need food assistance or that their electricity has been interrupted. 8 out of 10 lack access to sufficient clean drinking water, and 3/4 need hygiene items, and 1/3 or 34% urgently need medication for chronic illnesses. Next slide, please. HelpAge is very uniquely positioned to respond in this crisis for a number of reasons. First of all, for over 20 years, we have been working with older people in humanitarian crises all around the world, from Haiti, the massive earthquake response, to older South Sudanese adults in refugee camps in Tanzania. I mean, on and on and on. And we work with older people in disasters, in conflicts, and a variety of humanitarian crises. And since 2014, as I mentioned, we've been implementing humanitarian programs ourselves and with partners in Eastern Ukraine funded by USAID. Once again, USAID recognized there was a large amount of older people, largely younger people, move, as they do all around the world, to the big cities, to other places when conflict arises or other demographic pressures compel them to leave. So older people are left behind, they're alone, they're isolated. We have been providing everything from home-based care, psychosocial support, protection for older people, non-food items, etc. So we are in place. We are actually one of the few international non-governmental organizations on the ground in Ukraine. We have a total that have been on the ground in Ukraine. We have a total workforce of over 250, including volunteers and contractors. The main office is in Kyiv, with field offices in Luhansk and Donetsk regions, and an office in Lviv is opening soon. Because we're a global network, and because we have a place on the ground around the world, in low middle income countries, and in particular, we have a country office in Moldova and a strong network partner in Poland. With those, we are able to cover not only the entire country of Ukraine with local partners, which are listed there on the left-hand side, but also work with the refugees going to Moldova and Poland. Next slide, please. We are coordinating, so HelpAge always works collaboratively, of course, with other partners, and we are coordinating with the UN High Commissioner on Refugees. We are one of only 5 international nonprofits who are working with the UNHCR coordination structure. We are participating in the Protection Working Group in Ukraine, the Asian Disability Technical Working Group, what they call the WASH, or the Water, Sanitation and Hygiene Cluster, and the Cash Working Group in Moldova. Next slide, please. The overall response plan, I want to emphasize right here, and can't say it enough, as you all know, this is constantly changing. We have a dramatically shifting situation. Our initial target population is 430,000 older people, people with disabilities and their families. Focused on initial life-saving activities in the eastern regions of the country, everything from providing food and water and diapers and whatever is needed to protect lives, seeking to dramatically scale up not only the east, but the central and western portions of the country, as well as assisting the refugee migration to Moldova and Poland. We do have, for example, a center opened up in Moldova that is taking refugees. There's a quote here from somebody saying, "I convinced my mother and grandmother to come to Moldova," and the center has arranged accommodations for us together. Next slide, please. Just a little more detail. So, there's always, so a disaster has a response and a recovery phase. The response is what happens immediately. We'll also, of course, be developing a longer-term recovery strategy. So this is the short-term and sort of that we're talking about right here, but it encompasses things like, life-saving humanitarian services and support, food and safe water, emergency non-food items and hygiene kits to maintain a safe living environment, immediate protection needs for their safety, and providing psychosocial support, as you can see the quote on the right. And you may have heard some of these on TV or in the news, a lot of trauma So the center psychologist in Moldova said, the older people are very traumatized and not ready to talk about their situation, but most importantly, they cannot accept what has happened to them. We also are providing health equipment and consumables to health facilities and multi-purpose cash transfers and vouchers to meet basic needs. Next slide, please. This is an initial funding target. Once again, absolutely going to evolve. This is what we are ingoing estimates about categories of assistance in the 5 different areas of cash, water, sanitation, hygiene, or what's called WASH, non-food items, health and protection, and mental health and psychosocial support by country. And so this is something that we expect to evolve, but it helps with some framing and structure around what the initial needs and plans are. And I just want to have one last slide, if you could switch please, Emily, to donor confidence is important. It's a crisis, and donors always want to be confident how their money is being used, but it's important to have mechanisms in place and know what those mechanisms are as we're going into this. HelpAge is the go-to organization for UN funds and USAID funds to support older people. We have strong compliance mechanisms in place to deliver humanitarian aid and have a demonstrated capability in delivering responses in different conflict contexts like Yemen, Syria, South Sudan. We follow core humanitarian principles and accountability and are tested and recognized by the Disaster Emergency Committee, or DEC in the UK, as well as the Foreign Commonwealth and Development Office in the UK, or FCDO. And we have strong humanitarian standards of accountability and monitoring, and we are a member of the Core Humanitarian Standards Alliance. Next slide, it just wraps up there. So thank you for the opportunity to share at a high level what's happening. And Liz, if you feel free to just go back to the beginning, or we're happy to provide contact information to anyone about how to reach us. But what I'd like to do is open it up at this point to any Q&A. Akbar is in Moldova. He's on the ground. He knows what's happening. He's working with what's happening. Akbar has managed our program in Ukraine, so is intimately familiar. And Sharian is also will be helpful in terms of addressing any questions about different mechanisms, et cetera. So thank you.
Thank you so much, Cindy, for that overview. So again, please type your questions into the chat. I'll just start by asking, are the people that you're helping mostly people who were known to HelpAge prior to this conflict? How are you finding out about people who are in need?
Yeah, so actually I'm going to direct some of these to Akbar because he's been working with a program in Ukraine where we've been working with 5,000 people. Akbar, do you want to take that?
Yeah, sure. Hello to everyone. So yeah, the first initial phase of all our intervention is starting from the conducting vulnerability needs assessment, where we asking and where we communicating with the local authorities. As in the slides mentioned, so we started working in 2014 in eastern Ukraine when the conflict initially started in 2014, when the NGCA, non-governmental control areas, appeared in the east of Ukraine. So at that time, we decided to respond directly there. And first of all, we are getting in contact with local authorities and to find out the general official statistics. And soon after, through our network of volunteers, we are conducting this vulnerability assessment where we asking almost all the people population there in terms of their vulnerabilities. And then based on that, we have scoring system. And based on that scoring system, we are identifying their vulnerabilities and then we helping them, assisting them. Thank you. Over.
Thank you so much. And shifting to the response network that you just alluded to, Nancy Zients asks, how are you working with other organizations on the ground who are there long-term serving older people? And I'll just add to that, is there a local philanthropic infrastructure in Ukraine? Are there Ukrainian community foundations? Are they responding? Have they all evacuated? What's the status of, the local NGO network and any local philanthropy?
Yeah, so we have a close partnership with different actors in Ukraine, starting collaborating on the governmental level and ending with the local non-governmental organizations. So and as well, we are in close coordination and we are closely working with different international NGOs within the different type of consortiums, helping to older people and people with disabilities. But worth to mention that in Ukraine, we have two HelpAge International network members. So into different sectors of the response, and geographically, they're covering different areas. When the older people themselves, they're grouping each other and they're building the kind of initiative group, and then they're helping each other in those communities. So it is quite often we can see this. So the older people themselves, they're forming different groups and helping each other.
Cindy or Cherian, is there anything you want to add to what Akbar just said?
Oh, thanks, Lindsay. I think there are local organizations, as Akbar has pointed out, and we are in touch with them, and we are also working along with the local organizations. So one of the primary goal of the HelpAge International is also how to promote and enable the local organization to help and support the older people for their dignity, for their voice. I think that's one of the paramount principle of the way we work. So we are mobilizing and making sure that they also follow the humanitarian principle as they operate in this context.
Thank you. We have a question about nursing homes. What's happening with older people who are in nursing homes right now, where areas have been bombed?
Yeah, unfortunately, for the nursing homes and for entirely the population of those locations where shelling is happening and where the active shooting is happening now, it is quite difficult to access them. I would say, like, for ourselves, for HelpAge beneficiaries, currently we have more than 4,000 beneficiaries, more than 4,000 older women and men, which we are supporting. And at this moment, unfortunately, we didn't manage to reach any of them. The only things what we are doing through our network member, through our community volunteers network, which is more than 250. So we are reaching them through the phone. In very difficult conditions, the communication is not quite good, but we are trying to support them. At least we are providing the psychosocial support through the phones to those older people. Again, we are receiving, because HelpAge International in Ukraine, we are leading Age and Disability Technical Working Group. And with that group, we are receiving a lot of requests about the people with disabilities and older people evacuation from different hotspot zones and hotspot cities. But unfortunately, at this moment, we cannot do anything because of the first of all, because of the safety and security of our staff. And then there is a high shelling ongoing. And even ICRC, International Red Cross Society, even they cannot manage to get and to reach those locations. And that is why one of our goal and what we are doing, and we are signing different notes and asking that the first of all humanitarian corridors should be guaranteed inside of the conflict, specifically at those locations where active shelling is happening. Unfortunately, until now, several times the humanitarian corridors was announced, but unfortunately they absolutely didn't work, and nobody didn't manage to leave those areas. This is yeah, actually what's happening now. Over.
Thank you. Can you talk a little bit about access to medications, particularly for those with chronic conditions? What are the strategies for getting medications to people in need?
If we talk about those areas, which is, I mean, those restricted areas where we cannot reach. So as for the moment, local authorities are trying to support them based on the initial formed some small stocks which they had. And it is important to mention that even local businesses now is very, very united and in one solidarity, they are responding to this, including those pharmacies and including small shops and everything. So they are just free of charge now. They're delivering and giving those small stocks which they have in small settlements to the local authorities. So some of the local authorities members, if they can manage, then they deliver medicines and to those in need. But the general situation is very difficult, specifically in Kharkiv, in Sumy, in Mariupol, and soon. So it is kind of forecasted that the situation also will be very bad in Kiev itself. It's the capital of Ukraine. So and it's also worth to mention that the many big warehouses inside of the countries also already were under the shelling, and and those big warehouses where the medicines and different type of governmental facilities and suppliers were kept, almost all of them they destroyed. And that is why the country is in desperate needs of different supplies and food, medicines, non-food items, hygiene kits. So yeah, this is what's happening. Over.
And is the best strategy to collect those items and send them over, or is it better to donate cash and then they can be purchased locally?
If you look to the map of Ukraine, so the eastern part of Ukraine, where the conflict initially has started, so now most of the active shelling and active war actually is happening in the east of part of Ukraine and through the northern as well. So all of those locations has very, very limited connection to the different type of suppliers. We've connected with many suppliers, and they're saying that even if they have some small stock, but they cannot deliver because of the safety and security of themselves. But if we look to the more central part of Ukraine and goes to the western part, market there is functioning. So it's mean that according to our plans and according to our humanitarian response plans, we are planning to distribute their cash because the market is functioning and the banks and ATM machines is working. This we can transfer and people, they can withdraw money, or if we deliver cash to those in need, then they can go to the shop and buy. But what's about the, as I said, Eastern, then we need just suppliers which could be delivered, again, considering the safety and security of the stuff.
Can you talk a little bit about food? How are people accessing food, particularly older people? And are you seeing that most of the older people who are still there have been separated from their families? Are they by themselves?
Yeah, for those in our location in east of Ukraine, so all the people there, usually during their summer season, they're kind of preserving some type of food for themselves. And actually it keeps them a bit, I mean, they have something to keep them, but again, it couldn't be longer. Based on one of our needs assessment, which we've done in August last year, so almost 70% of all the people, they said that they have a stock of food only for 5 or 10 days only. And it is already, I mean, that the situation already was very difficult because of the, again, limited pension which they receiving. Yeah, so the situation in terms of the food, yeah, it's quite difficult. And based on the rapid needs assessment which we've done at the beginning of March, so it's again showing the high number of food that they need of food. And all the people, and if there is Washington group of questions where we are assessing the disability, the level of the disability, and based on that, we are usually getting the high percentage that the older people are with disabilities, and it's making their life more difficult to access to the food, or to go to get that food. And based on our experience, usually the neighbor houses, or then all the people neighbors, usually they are looking after them. At least they are coming to them and once time per day and asking and bringing some food or sharing some food if they have. Over.
How are people accessing information right now? What communications channels are open, have not been compromised?
So again, it depending which area we are talking. So for the central and western part of Ukraine, so all internet connection and TVs, radio, mobile network are working perfectly, and so people are very good, have access to all these type of governmental information as well. And usually the government also, they introduced the separate line, kind of in-country roaming, when, for example, one mobile network is not working, so they can easily connect to another mobile network. So just to make sure that the people are in contact with each other. But if we talk about the Eastern Ukraine where we are operating, so the situation there is very difficult. And again, because of the shelling, so most of the communication facilities and infrastructure, it's destroyed. And all the people in our case, in our, like our beneficiaries, all the women and men, so they're relying mostly to the information from their neighborhoods and as well from our network of community volunteers. We've discussed with the community volunteers as well. And before, when we hiring the community volunteers, we have conducted for them 5 different type of sessions, how to communicate to all the people. It's kind of basic psychosocial support we are providing them. So those volunteers are very they know how to talk to them and what type of information to share with them. So it's mainly, yeah, this is what we are doing. But also, I would say that in the eastern part of Ukraine, in those settlements which is close to the non-governmental control areas, there is of course there is a problem of electricity. So and they cannot even charge their phones, or they cannot turn on TV or something like this. But if it is available, we should know that there are radio signals and TV signals from the other sides also coming. So the older people in some areas, they also can watch what other side are saying in TVs or in radio.
Thank you so much, Akbar. Another question is, what humanitarian support is being allowed at this time in Eastern Ukraine, and how are you protecting yourselves and your team on the ground?
Yeah, for the moment, our 14 team members, they're in Slovyansk city now. except 3 of them. So 2 of them, they're in suburb of the Severodonetsk, which is yesterday and today it was under high shelling. And one of our staff member, Olga, she's in Mariupol, and it is almost 1 week that we lost connection with her. And Mariupol now is almost kind of circled by the Russian forces, and the city is under high shelling. And as we getting reports from the media, so no electricity there, no water, nothing, and we are just hoping that she is safe and in some shelter. And our staff in Sloviansk, so far Sloviansk, there wasn't any incidents so far, but as today it reported that just today there were 7 air alerts already. So it means that during these alerts, you have to run to the shelter, bomb shelter, and all of our staff just doing that one. And at this moment, so all our staff members, they're on in hibernation mode. So they're in their apartments, in their homes, and just sitting so they're allowed to go to the curfew, usually starting from 5 p.m. until 9 a.m. Over.
Next question. What organizations are most effective in getting cash donations to those in need?
Usually, I would say because cash donation, it's mean that in the organization the system of compliance response mechanism should be available with different type of monitoring and evaluation. And usually international organizations are providing these type of cash donations, and specifically those organizations which are working in Ukraine since like long time, like we are as a HelpAge International. And in the organization, there is a national post office. So as if we say about the procedure, so we are transferring them, and with the list of all the women and men, and they physically they have a postmen in many settlements, so they're delivering to the beneficiaries. Also in Ukraine, there is a quite good and dynamic cash working group is available.
Yeah.
And HelpAge International also the member of that cash working group, where the many organizations are coming and sharing information and also cross-checking to avoid duplication of these cash transfers.
Who else is around the table at that cash working group? Can you just give us a sense of who's working on this?
You mean organizations? So there is ACTED, People in Need, MDM, Medicine du Monde. So yeah, so this is few of them which are working. There is national NGO, it's called Proliska. Yeah, so I can share the list later. So it's quite yeah, they have quite intensive meetings, and it's quite useful because as well every time, I mean every quarter we are revising the cash amount itself, the cash donation amount itself. So just to make sure that it is according to the prices in the market, and kind of it's relevant, so that the people could buy what they need.
If I may add, Lindsay.
Please.
So if I may add, I think the cash transfer is not an easy task, or cash donation is not that easy. Once again, the HelpAge is uniquely positioned, as Akbar has said. We have a partnership agreement with the National Post Office Service. And while we are donating to or transferring cash to the older people, there are 2-3 elements we need to look at. One is that how they can easily access, how they can safely access. We don't want to have any abuse on them while transferring cash, and also how regularly they can access, consistently they can access. Lastly, most importantly, how we monitor the cash, the value of the cash in terms of the cost of living, so that they can afford it, and that is, they can afford with the cash that we are supporting them. So I think, again, it's a very professional approach to cash distribution. It's not that we go and stand and start distributing cash to the older people. It's a very thorough, professional, humanitarian approach. And there is a track record, there is a monitoring, there is a beneficiary verification. All these are involved in when we do the cash transfer.
Thank you, Cherian. Cindy, was there something you wanted to add? No. Okay. For people who now wish to evacuate, what is the process? Is it possible for older people to evacuate at this point? What transportation is available?
You're mute, Akbar.
Yeah, sorry. As I mentioned earlier, so in those cities which is under high shelling, like Kharkiv, Mariupol, Volnovakha, and other locations, there is absolutely no guarantee of the safety and security, and there is no humanitarian corridors available to evacuate local population. This is the most urgent things which we are advocating in different level inside of the country, within the UN coordination system in Ukraine, as well through our headquarters. We are asking for this. So this is, I think, the most important and life-saving efforts if we do this one, to advocate and to push both sides to open that humanitarian corridors. But not just open and guarantee the safety and security, then the evacuation could happen. And then all the people and people with disabilities could be evacuated. So there is a many discussion recently and these days about the evacuation of people with during our technical working group, that at this stage it is absolutely impossible. So nobody can send their staff members because of this shooting and under the shelling to do anything. And that is why what we are doing and what we can do at this stage does just to advocate and to work in different platforms to push UN, government, any other sides, just to make sure that the humanitarian corridors is available and we can do it. Yeah, so that's it from my side, I think, on this point.
You mentioned in your slides, I think, plans to dramatically scale up in Eastern and Central and Western regions. What does that look like, scaling up?
You mean our activities?
Mm-hmm.
Yeah, so what we started from the just beginning of the conflict. So we've conducted this rapid needs assessment, which is showing that how the situation is difficult and how the people, and specifically older people and people with disabilities, are in needs. And these kind of inform not other actors but ourselves as well, where to focus and what to do in terms of the support of those in needs. What we are planning, at this stage, through our through our network members, we are planning to scale up our response in central and western part of the region. And based on the data, what we are receiving, so almost more than 1 million of people already, they left the country through the western area of Ukraine to Poland, to Hungary, to Moldova, and according to the UNHCR and according to other agencies, we can see that those who are living there, mobile people, they're a bit wealthy people who can leave, but who remained in the country is older people and people with disabilities and their carers usually. So it's mean that there currently, if we look to the trends of the IDPs, internal displaced persons, so they are coming from the east to the central, and those in center, they're trying to move to the west. So if you look to the map, so there is already several clusters of the disabilities in different parts of the areas of Ukraine. So we are trying to respond to them depending on the locations, as I said earlier. So in the eastern area and in the central east area, it is quite difficult to distribute cash and to get suppliers. But what we are trying to do there to form the stock and start distribution of food and non-food items to those in needs in different collective centers where internal displaced persons are there. In western part of Ukraine, so soon we will open our office in Lviv, and in eastern part we will start the multi-purpose cash distribution to those in needs, and as well we will support those collective centers as well in terms of the institutional hygiene kits to those centers, so to make sure that the hygiene is guaranteed, provided in the centers, and as well to all those residents. We are providing different type of kits, cash as well, and just bottled water as well. So and as well, we have a plan to conduct soon and the rapid needs assessment as well in the western area close to the border to Poland and to other countries.
Akbar, who are your volunteers? Are they people who are, native to Ukraine? Are they people who've come from other places?
Yeah. So usually what we are looking when we are starting working in those locations. So we are looking for the activists from those locations. So those volunteers usually are teachers or social workers or former accountants. So it is those people who are who educated, literate, who have very good experience on community mobilization. So we are in contact with them, and we are trying to we providing some intensive to them, so to reimburse their cost of communication, their kind of transportation costs when they're reaching all the women and men. And that is why we were able to conduct this rapid needs assessment in eastern of Ukraine, because of those volunteers who are still in their communities and still providing psychosocial support to the beneficiaries.
Thank you. Oh, Cherian, did you want to add something?
No, I just wanted to go back to your earlier question about what is the scale up will look like. Yeah. For us, scale up will look like in 4 areas. We have a methodology to really identify the community volunteers, training them and bringing them into a response. So one is that scaling up and identifying the community volunteers wherever we have the location. So that's one way of scaling it up. The second way of scaling it up is that we will have more local partners recruited for the response. That is an important one that we will set it up. The third way of scaling up is that we will actively partner with logistics and supply chain companies or NGOs who will really help us to get end-to-end solution in terms of moving goods or procuring goods so that we can reach to the settlements as quickly as possible, and we'll support them. We have the community and social mobilization skills, and what we match with is a partnership with the logistic and supply chain expertise so that we can fully maximize our scale up. So that's a kind of a usual way of expanding our work in a particular given situation.
Thank you so much. That's really helpful. Let's talk a little bit more about humanitarian corridors and whether there's an opportunity to mobilize support around, having those corridors in place. And if so, what is the best way to do that? There's a question in the chat about, are there local photographs or short videos? How are you raising awareness of this issue? There's a question about when this video will be available, and a very good question around what information will be permitted to distribute, because we first and foremost want to take the safety of our speakers and their families and the teams on the ground into consideration. So can you speak to that a bit?
Cherian, would you like?
Yeah, I can speak a bit. What is humanitarian corridors? Who agrees to that? Let's get to the fundamentals. We need to understand that any conflict or a war situation, those corridors need to be agreed by the warring parties. That means the Ukrainian forces and the Russian forces. That's the starting point. Yeah. Then the UN and the ICRC, International Crescent Red Cross, they are the one who mediate that and make it possible for other local NGOs and INGOs to participate. So it's a very, very different levels of processes. So what we have been seeing in Russia, in Ukraine, is that one of the parties of the war is frequently, they decide there is a humanitarian corridor, suddenly they start shelling and the places. So it is very unstable. So that's why Akbar is talking time and again that there are declaration of humanitarian corridor, but it is unstable and not inconsistent. In that situation, it would be highly unlikely that older people and disabled people will move because they need a stable, a lengthy period of humanitarian corridor access to move or evacuate. So it's a very different processes. It's a very complex process, I can say. But as an INGO, what we can do is to put pressure on UN and others to make that feasible in this situation. That has been our topmost advocacy messages: cessation of hostilities, creating corridors, having humanitarian access. Some of you asked about what about the medicines and life-saving medicine, those who are in those conditions with the non-communicable diseases. It's a very, very painful situation. We all can imagine. So unless and until there is a pause, nobody will be able to reach them. Nobody will be able to help and support them. That's the kind of a situation that we are in. Yeah. So I just wanted to share that. That is the case in all the conflict situation. But in some of the previous experience, some of the conflict situation, both parties agreed. There was a pause, and we could do those kind of a movement. But in this case, we are struggling to get that consistent message.
And is there an opportunity for Grantmakers in Aging or our individual members to assist you to amplify your advocacy efforts for humanitarian corridors?
I think one of the ways, this is something that Cindy can also help. One of the ways of what we are requesting is that all the donor governments, including the US, if they can put pressure on UN and others, and things can work. We are a very small player in the whole things. It's a European Union and many other international community. The best way to put it, the international community needs to put that pressure. So if we can influence your own government, for example, in terms of highlighting the situation of the older people and their condition, therefore there's a very consistent and agreed humanitarian corridor is necessary. That's how we can highlight that issue to your own government, and then they can really push that, even the UN and Security Council and many other processes. So that's the best way to do, rather than we doing something. We are we are very small in the whole play. What we are good with is that our humanitarianism. We will be able to help and support, but we need our own protection. We can't put our staff into danger. One of our core humanitarian principles is to we need to get the staff safety first. Whenever there is a safe passage, we are ready to engage in outreach and help and support. I know that's how the whole system works, and any support that your organization can provide in putting that pressure to your own government, and that would be highly appreciated.
Lindsay, maybe we can strategize afterwards about what we may be able to do together to from the aging community in the US to do that.
Absolutely.
Yeah. That would be great. And certainly I can, there is no issue at all with posting the summary report on the, I think the only question was whether there were any issues about the video, Cherry, and I don't know if you can answer that now, but the video being posted. Yeah, well, we can get back to you about that. But the summary is, that's okay to post in terms of what.
We'll send that out.
Yeah.
Thank you. Well, we're coming to the end of our hour. And so perhaps the most important question is, should anyone on this call wish to contribute, to support your efforts on the ground in Ukraine, how would they do that? If they represent a foundation that might be able to make a grant, or if they're individuals who want to make a donation personally. Can you talk us through that? Put the information in the chat. Give us some specific instructions.
Yeah. So I would say that for, and Camille or Paige, maybe you can go ahead and put my contact information in the chat. Email address would be the best way to reach out, particularly for any larger grants. That would be the best plan, and we can work with you and work with our colleagues. And in terms of individual donations, we do have a donor portal on the HelpAge USA website. That's at www.helpageusa.org. And so we would certainly appreciate any support from individual donors to that. That would be the most feasible way for smaller individual donations. For grants, the best thing would be to contact me, and we can work with any organization to shape that donation.
Okay, and let's just put that in the chat.
Yeah.
What was the address again for the donor portal?
HelpAgeUSA.org. And we can certainly provide more images of older people. And thank you for all of these suggestions, and can work on any other visual components to help support the messaging, and really appreciate everyone's advocacy and support of our work on behalf of older people in Ukraine. So please do not hesitate to reach out to me directly or to contact us.
Thank you so much, Cindy, Akbar, and Cherian. We so appreciate your taking the time out of the really important work that you're doing to speak with us today. We're here to support you, and we will follow up with some additional information as we receive it with everyone who's been on this call. And Grantmakers in Aging will follow up with HelpAge to determine the best strategy for advocating for that humanitarian corridor that is so critical right now. So thank you, everyone. Please be well, be safe, and we'll see you soon.
Thank you very much, Lindsay. Thanks to everyone. Appreciate it. Thank you. Thank you so much.